with sexually transmitted infections. So it's a group of communicable disease in which sexual contact is the most common, most important mode of transmission. So there are many risk factors for sexually transmitted disease, as you may have known that first, the most common risk factor is multiple sexual partners and high risk sexual activity and IV drug use, a younger age at the beginning of sexual activity, poverty and lower socioeconomic status, poor nutrition and hygiene. So we have different sexually transmitted diseases. So first of all, we have viral infections. It's most commonly known acquired immunodeficiency syndrome, genital herpes, and genital warts. These are viral infections. And the second is bacterial. The most common of which is syphilis and gonorrhea, chlamydia, chancroid. And for parasitic infection, sexually transmitted infection, it is trichomoniasis. So, am I clear till now?
Yes, madam, yes.
Thank you. So, coming to the viral infections, coming to the bacterial infections, we will start with syphilis. So, it's a worldwide disease affecting mainly the age group from 15 to 39 years, and it's recently found to be increasing. There are the most common organism is spirochete, and this is Treponema pallidum. And you can see the picture here. It's a delicate bacteria which is rapidly killed by drying and high temperature disinfectant soap and water. So the most common, so untreated cases in which this infection, it's usually infectious later on about these stages. So these usually occur during the first 2 to 4 years. So the syphilis is usually infectious for 2 to 4 years, and usually it is exited through exudates of skin, mucous membranes, blood, and body fluids like semen, saliva, and discharge. And the incubation period is the time period from the exposure to any infection to appearance of the symptoms. So in the case of syphilis, it's about 3 weeks. So a transmission, the most important is sexual contact. It usually happens with by contact with open lesions. Second is kissing, as it is also spread through saliva. And congenital syphilis, it usually spreads from mother to baby. If the mother is having syphilis, especially in the third trimester. And apart from that, if there is any contact with contaminated articles, it can also spread. The congenital infection, it is usually a transplacental. It starts from fourth month till delivery. And inoculation of infection, it can happen either through contaminated syringes, needles, or blood transfusion. So you can see here in this diagram, we have the congenital and the acquired. Congenital, it happens, it is transmitted from mother to baby, and it is early syphilis if the symptoms appear in the first 2 years of the age of baby. However, we call it as late if the symptoms they appear in the late phase, that's after 2 years of life. The acquired, which is usually transmitted through sexual and blood transfusion. So it is early syphilis and late syphilis. Early is further divided into primary, secondary, and early latent. However, the late is divided into neurological, cardiovascular, gametous, and latent lesion. So you can see here from this diagram, it's the natural course of syphilis. The first is the exposure, which may happen during 9 to 20 days. You can see here. The primary syphilis is usually between first 9 days to 6 weeks, and then primary is transferred to secondary, and then latent, which happens after the first 2 years, and then late latent phase. Are you following me?
Yes,
Yes,
ma'am.
ma'am.
Okay,
Yes,
so
ma'am.
primary syphilis, you can see here, the picture is shown here. You can see the chancre. It is the most common feature in the primary syphilis. The picture you see here, the chancre, it appears on the lip as well as chin of this man. So it's the most common feature of primary syphilis. It's a firm, indurate, painless, and highly infectious ulcer. So we have two types of ulcers, which I will later on tell you, the syphilis and the herpes. The most common differentiating feature between the herpes and syphilis is that syphilis is painless ulcer, however, herpes is painful ulcer. Okay, so you can differentiate between the syphilis ulcer and the herpes ulcer. Between both of these, the pain is the main differentiating feature. For syphilis, it is painless ulcer. It's highly infectious ulcer, and there may be some enlarged lymph nodes, and they spontaneously disappear without treatment after 4 to 6 weeks. So even if we don't treat the patient, the symptoms may disappear after 6 weeks. So the secondary syphilis, you can see here, usually there is generalized skin rash in secondary syphilis. So there may be patchy lesions of mucous membranes, especially in the mouth. And also the other parts of body, you can see here like back, foot, arms, and hands. So they usually disappear within weeks or months following up. It is followed after by a latent period. Um, and then we have the late symptomatic syphilis. You can see here, usually the symptoms, they reappear in the late symptomatic syphilis. There may be some neurological, cardiovascular symptoms, and also it may involve different parts of the body. So usually the diagnosis is based on history as well as a clinical picture. Yeah, like you have the history and the ulcers, the typical ulcers you see on the clinical examination. And the third is the laboratory investigations. Usually we do the dark field microscopy examination where we see the typical organisms of this syphilis, this spirochete, which is usually a delicate bacteria. Then we have serological tests. Usually the non-treponemal tests, these are non-specific tests. They are used for screening. Like we have to just use them to diagnose. And the specific tests, these are treponemal tests. These are used to confirm the diagnosis. So we use the treponema antigens in this. In non-treponemal, we use the treponemal antibody. So we have different tests. There is the venereal disease laboratory VDRL, which is commonly done. However, it is high false positive, so it's usually uh, not a specific test. So the treponemal test, which is a specific test, it includes the fluorescent treponemal antibody absorption test. So for prevention, first of all, we need to do the preventive measures so this disease can be prevented. Like we have some general measures like avoidance of sexual promiscuity, health education to increase the awareness, use of condoms, and contact tracing. So anyone know anything about contact tracing? What does it mean by contact tracing? Can anyone tell me about the contact tracing? Hello?
Ma'am, no specific idea about contact tracing.
Okay, so contact tracing means like we trace all the persons because these conditions they are spread through multiple sexual partners. If we identify a case of syphilis, like we are studying the syphilis, any sexually transmitted infection, if it is identified in any individual, so we check all the sexual contacts of this person in the last 6 months. If they have sexual activity, and then we do the testing for the syphilis in all of them. Do you understand me now?
Yes, ma'am, it's clear. Thank you.
Yeah. So we have to do the contact tracing because it can spread from one person to other. If the other contacts uh, uh, they have the sexual activity some other people, then they can spread the syphilis to others as well. So we have to do the contact tracing and treat their partners as well. So the specific treatment is chemoprophylaxis. So we give one dose of 2.4 million units of long-acting penicillin IM soon after exposure. So there is a specific treatment as well in which we give same penicillin 2.4 million units in a single dose intramuscular. If these are there are some penicillin allergic patients as well. In those cases, we use doxycycline. This is 100 mg twice daily for 14 days. So for all the sexually transmitted infections, we do the re-examination after treatment to confirm that we have successfully treated the infection. So second is gonorrhea. This is also a sexually transmitted infection. It's a bacterial infection. So if we don't treat it on time, the acute infection can have long-term effects on the patient. So it's a gram-negative intracellular diplococcus that perishes rapidly outside the body. It's Neisseria gonorrhea. The reservoir is main in this case as well. So a case who is infectious for months or years, if not treated, and while the treatment eliminates the infection within days. So it is seen in discharges of infected mucous membranes. Transmission is direct sexual contact only. It does not spread through any other body fluids like saliva or anything like blood. It's only through vaginal sex. So incubation period for this is also 3 to 4 days. The clinical picture, it usually starts as an acute infection, and if not properly treated, it can become chronic. Like in males, it causes urethritis with purulent vaginal discharge. In females, it causes urethritis or cervicitis with discharges. And in long term, if kept untreated, it can lead to arthritis, pharyngitis, rectal infections, septicemia, endocarditis, or meningitis may occur in both sexes. So you can see here the pictures. Um, First, you can see in the picture that there is for males, which discharge and cervical discharge, it also leads to infection of the eyes, especially in the newborn children. And if there is direct inoculation of the bacteria through fingers to the eye, it can also lead to infections, mouth ulcers, and lower abdominal pain. So the diagnosis is usually history and clinical diagnosis. Investigations in acute cases, we do the demonstration of causative organism from the film of pus taken from cervix or urethra. And in chronic cases, we do the serological test. Serological test is the blood test. We use complex sexually transmitted infection. Prevention is the same. Education, avoiding sexual promiscuity, as well as contact tracing. The treatment for gonorrhea is very simple. So you can see here, either we give the amoxicillin 3 grams orally as a single dose. Means we give ceftriaxone injection 250 milligrams is single dose intramuscular. And for all the sexually transmitted infections, we do the re-examination after treatment. And for if there is any contact, like the person who has been diagnosed with gonorrhea, if he has any partner or any contacts, we give them a oral penicillin 400,000 international units. So the third is chlamydia. Dr. Amna, do you have any idea? Dr. Asma,
Uh, Hello, ma'am. Can you hear me?
hello.
Yes,
Yeah, yeah.
yes. Chlamydia is a bacterial infection that usually spread through sex or contact with
Mm-hmm.
infected person through body fluid like semen or vaginal discharge. So, this is the cause.
Okay, great, Dr. Amna. Sorry, I haven't asked all of you about your level, like in which class you are in. Are you all in final year MBBS or what? I'm so sorry, I haven't asked you before that.
Ma'am, there are different categories of students. Some are in first,
Oh,
second year, some are
Yes,
graduated,
ma'am. We
and
all.
this is a mixed group.
okay. So I'm so sorry. Some parts of the topic may not be suitable for the juniors, but as it's a mixed group, so I have tried to complete the topic as in detail as I can do it. It's a very long topic, so I will try my best to cover it. So if you have any confusion for the juniors, please do ask me, okay? So coming to chlamydia. So chlamydia, it is caused by Chlamydia trachomatis. It's a gram-negative bacteria. Transmission is usually through vagina, oral, or anal sex. Incubation period is infection. It's the period when exposure to it's the infection when you are exposed to some infection and then appearance of the symptoms. So it takes around 1 to 3 weeks from exposure to appearance of symptoms in case of chlamydia. So while chlamydia is sometimes called a silent infection, is it is seen that majority of people between 50 and 70% who have chlamydia never notice any symptoms. So it's very silent infection. In men, it also the symptoms may happen in men as well as women. For men, there may be dysuria, urethral discharge, proctitis, epididymitis, rectal discharge, pain during defecation, fever, unilateral scrotal pain, fertility, and reactive arthritis. For women, mucopurulent vaginal discharge, cervicitis. It's the infection of the cervix. Urethritis is the inflammation of the urethra. And dysuria, pyuria means pus in the urine. These are the urinary symptoms. There may be menstrual abnormalities and pelvic inflammatory disease. Also, it is a main cause of chronic pelvic pain in women. It may lead to infertility and also perihepatitis. Perihepatitis is the inflammation of liver. So the diagnosis is usually done through taken samples from either throat, urine, vagina, cervix, or rectal swabs. So we do the test nucleic acid amplification test, which is the most sensitive test in case of chlamydia. Direct fluorescent antibody test, enzyme immunoassay, and culture of chlamydia. And Then coming to treatment, there is the general measures like before treatment of partners, use of condoms, abstinence of sex for 7 days after treatment. And drug therapy is doxycycline, which is 100 milligrams twice daily for 7 days, and azithromycin is 1 gram single dose. If there is any contraindications to both of treatment, there are alternatives like erythromycin, ofloxacin, and levofloxacin. So we are coming to the viral infection. Herpes is viral infection which is sexually transmitted. It is caused by this herpes simplex virus. It enters through mucous membranes or breaks in the skin during contact with the infected persons. So it reproduces inside the cells and spreads to herpes simplex 1 and 2. One usually causes the infections above the waist. As you have usually seen by the herpes simplex virus 1. So second and perineum most commonly, but both of the strains can be involved in both the mouth or the genital infections. But however, the herpes simplex 1 is more commonly seen in infections above the waist. So you can see here, this is the pathway of the herpes infection. Herpes virus enters the body through the mucous membranes, and it usually lies dormant within the nerve cells. Usually, therefore, we see recurrent herpes in patients who have a single herpes infection. Like they have same symptoms again and again because the virus stays dormant in the nerves. And once, if there is any immunity is low, or if the patient is in stress, these infections usually recur in future as well. So the clinical manifestations, it's usually painful vesicular lesions. As I have already told you that the main differentiation between the herpes and syphilis is the pain. So you can see here that herpes has painful vesicular lesions that appear on penis, scrotum, vulva, vagina, cervix, or the perianal areas. There may be burning or tingling at the site as well. Primary lesions present for 17 to 20 days, and new lesions sometimes continue to develop for 6 weeks as well. Recurrent herpes, it means that herpes can occur again and again. It usually happens in 50 to 80% in the following year. Triggers, as you can see, stress, fatigue, and sunburn. The prodromal symptoms may be tingling, burning, itching at the site of the lesion. You can see here the common complications which may happen due to the herpes, which is the inflammation of the brain, meningitis, which is the inflammation of the membrane surrounding the spine and brain, as well as progressive outer retinal necrosis. It leads to rapid affecting the retina, leading to loss of vision, and Ramsay-Hunt syndrome, in which what happens that the facial nerve paralysis occurs, leading to the typical facial features like drooping of the eyelid, deviated angle of the till now.
Yes, madam.
It's a very boring topic. However, you need to study it as it's an important topic for you. So, examination. It's usually a very typical picture. So you can easily identify herpes lesion when you see, especially on the mouth as well as in the genital areas. And clinical diagnosis of genital herpes should be confirmed the lesion by nucleic acid amplification test or the culture. So this is the type specific, like we can diagnose which type of herpes is either 1 or herpes simplex virus 2. The other is PCR. It is also the test of choice for diagnosing herpes simplex virus infections affecting the central nervous system and systemic infections like meningitis, encephalitis, and neonatal herpes. In these cases, we do the PCR, that is polymerase chain reaction. So the treatment includes the general measures. Is these herpes lesions are very painful, and usually when the patients come, they have very typical features like they have burning pain, they have difficulty in passing urine. So we usually tell them regarding sitz bath. Sitz bath mean that they use this warm saline water, and they sit in that warm saline for 10 to 15 minutes. So it leads to reduction of pain. Also, they can apply local anesthetic creams like lidocaine gel or lignocaine gel. They can apply over the lesions. And the third is it is very important to wear loose fitting underwear. Local hygiene is very important, and keeping the lesions clean and dry. And the last but not the least is barrier methods during sexual activity. It reduces the spread of the virus. So the treatment is commonly used is acyclovir, and we give 400 milligrams 3 times a day for 7 to 10 days. And if acyclovir is not there or contraindicated, we can either give famciclovir or valciclovir. So the treatment can be extended if healing is incomplete after 10 days of therapy. And topical therapy with antivirals like this acyclovir cream has minimal clinical benefit and is discouraged. So we can only give oral tablets for these patients. So we have another viral infection, HPV, which is human papilloma virus, which leads to genital warts. So, human papilloma 11, we have also 16, 18, 32, 35, but we commonly see 6 and 11. So, it is usually asymptomatic. So, the patient may be unaware of the infection. It is highly contagious. And incubation period is 3 to 4 months. You can see here, these are the warts in both pictures. So these are also painless, discrete single or multiple growths. They may be white to gray and pink flesh colored, as you see in these pictures. The patient may have itching with genital warts. Warts in men usually happen on penis, scrotum, around the anus, and urethra. However, in women, usually they occur on vulva, vagina, and cervix. Diagnosis is usually lesion, so we can easily identify on examination. The third is acetic acid application. So this is usually not a routine screening or diagnosis. We usually do this acetic acid testing in says this human papilloma virus has also been seen associated with cervical cancers. Yes, it develops carcinoma. Dr. Shazia, you are right. So it leads to cervical cancer. So we use this as we can pick up the suspicious. We can consider if diagnosis is in doubt or immunosuppressed patient is there, lesion is pigmented or fixed, or lesion worsening with therapy. And human papilloma virus test routinely is not screening, as human papilloma virus is associated with cervical cancer, as Dr. Shazia has already told you. So, treatment is effective methods. Medical is trichloroacetic acid, podophylline, and imiquimod. These are usually liquids and creams which we apply over the um, warts, and these are usually applied over weeks. However, if the warts they do not regress, then we go for electrocautery, that is the burning of the warts, interferon injections removal, and laser cryotherapy is freezing of the warts. And this usually, but the most effective is surgical excision, in which we completely remove the wart. So prevention, usually human papillomavirus prevention is done through vaccination. So vaccine is usually given for females between the ages of 9 to 13, and it's sexual activity. And the second is pap smear screening and pelvic examination, which is usually done after the age of 21 or when the patient is sexually active. And the third is same papillomavirus testing as well as pap smear. Along with that, we need to go for safe sex, healthy lifestyles, and regular HPV screening and testing. So these are the vaccinations, which are vaccine, which is against type 16 and type 18 human papillomavirus. And the second is Gardasil or quadrivalent vaccine, which is against the human papillomavirus 11, 16, and 18. The Gardasil is usually commonly used nowadays. So the most important AIDS, as you have already, you may know about this condition, acquired immunodeficiency syndrome. It's a life-threatening clinical condition that represents the late clinical stage of infection with HIV, which results in progressive damage to the immune and other organ systems, and especially the central nervous system. Causative organism is human immune deficiency virus, which is an RNA retrovirus. So these are usually, there are usually two serological and geographically distinct types with similar epidemiological characteristics. HIV-1 is found in America, Europe, and sub-Saharan Africa. However, HIV-2 is found mainly in West Africa. Yes, CD4 count is, yes, it usually depletes the T helper cells. Has specific affinity to T helper lymphocyte cells causing their depletion. Usually what happens that virus enters the healthy person, the virus attaches to the T helper cells and then destroys the T helper cells and then replicates itself. So T helper cell is an important part of your immune system. So if the T helper cells are broken down, they cannot fight against any infections. So usually in acquired immunodeficiency syndrome, the immunity is suppressed, so different infections attack the patient. So in same, reservoir is the main, exit is in blood, body fluids like semen, vaginal secretions, saliva, and tears. So period of communicability is so long the infected person is alive. So it is lifelong communicable disease. So the incubation period is variable, but 50% of those infected develop AIDS about 10 years after infection. So it remains silent over 10 years. The mode of infection, the most common and most important is the sexual contact, usually seen in homosexual as well as bisexual. In homosexual, it is very infective as it has been seen that anal sex is the most common route for the spread of, it has been seen to be the most common route in spread of this virus. So usually the most common population which is seen in this AIDS group is homosexual people. parenteral infection, PV drug uses, and contaminated blood transfusion. And the third is perinatal transmission, where we call this as mother to child transmission, MTCT. So, mother to child transmission is usually, it can happen during the pregnancy as well as at the time of birth and even after birth. So 25 to 35% of infants born to infected mothers are infected before, during, and shortly after delivery. It can also spread through breast milk to the infants if mother is breastfeeding. So you can get HIV via unprotected intercourse, pregnancy, childbirth, and breastfeeding, injection, drugs, and working in healthcare. Usually, the doctors, staff, and the people who work in hospital, they have been seen to be infected. Blood transfusions, organ and tissue transplant. HIV is not transmitted by, it's very important, not transmitted by insect bites, toilet seats, kissing, sharing cutlery, and touching. So non-specific manifestations are lymph node swelling, dry cough, pneumonia, sore throat, muscle pain, joint pains, headache, and difficulty in concentrating, skin rashes, fever, night sweats, indigestive, nausea, vomiting, diarrhea, nail thickening and curving, weight loss, and fatigue. The specific indicators of the disease are opportunistic infections. In AIDS patients, it is seen that many other infections are very common in them, like pneumocystis carni, pneumonia, chronic cryptosporidiosis, CNS toxoplasmosis. In neurological diseases, dementia and sensory neuropathy is seen. Cancers, the most common cancers in these patients are Kaposi's and extrapulmonary TB is also common in these patients. For this is the same picture. For the woman, you can see here in reproduction HPV, human papilloma virus, and cervical cancer. So it's very common in the AIDS patients. So we do cervical screening annually in these patients. Menstrual problems can be there, PID, pelvic inflammatory disease, urinary tract infections, and candidiasis, which is the vaginal yeast infections. Diagnosis is usually through a clinical picture, laboratory diagnosis, in which we do the serological test for HIV antibodies by ELISA, Western blot, indirect immunofluorescence assay, and PCR test to detect HIV antigen. Preventive measures, usually health education is very important, and avoidance of illegal sexual intercourse, use of disposable syringes and needles to be avoided, control of drug abuse, testing of blood donors for AIDS, and only screen blood and blood derivatives should be used. Proper sterilization of instruments and sharp objects, care in handling, using, and disposing needles and other sharp objects. No tattooing or acupuncture. So for AIDS, no vaccination or chemoprophylaxis is available at the moment. And it's very important that we screen the high risk groups like male homosexuals, IV drug abusers, who have persons with multiple sexual partners or who have infected HIV partners, and who have repeated blood transfusions like hemophilics. And also notification is very important for the AIDS group. Isolation of HIV positive is unnecessary, and disinfection of equipment contaminated with blood or body fluids and with excretion and excretions visibly contaminated with blood and blood products. Treatment is usually treatment of opportunistic diseases that complicated HIV infections. And the specific is antiretroviral treatment. It is usually complex. There are different drugs, multiple drugs are used. A single drug is usually avoided. So we have different drugs like the which is used like zidivudine, and different drugs we have for HIV. So, have you heard about post-exposure prophylaxis? Anyone? Dr. Shazia? So post-exposure prophylaxis is like if the patient, if anyone who has been in contact with HIV patient, or if any person who have a needle injury or have a blood transfusion or any contact with the HIV patient or any blood products contaminated with HIV virus. So we give the post-exposure prophylaxis. It is usually a combination of medicine which is given within 72 hours of exposure. So you can see here it to be effective post-exposure prophylaxis should begin as soon as possible, and to be effective, it should begin within 3 days or within 72 hours of of exposure. So we give these medicines, and there is a combination of drugs which is given to the patient, and usually given within 72 hours. Thus they avoid the spread of HIV infection in that person. So. It's very important. If anyone is contacted, they can get HIV post-exposure prophylaxis to avoid the infection. So patient and their sexual partners should not donate blood, plasma, organ for transplantation, tissues, cells, or semen for artificial insemination, or breast milk for human breast milk. This is very important. HIV patient cannot donate blood or their organs or breast milk. So, measures of contact is as I have already told you about the contact tracing. It's very important to notify all the contacts with the HIV who have been in contact sexually, who have sexual all those people, and then we have to give test them. And screening of contacts for HIV infection is important. Health. So last is which I am going to discuss regarding sexually transmitted infections is by a single protozoan called Trichomonas vaginalis. Some men may have irritation inside the penis, mild discharge, slight burning after urination or ejaculation. So the most common features they have been seen in the women. This is a frothy yellow-green vaginal discharge with a bad odor or fishy smell, discomfort during urination, intercourse, and vulval itching, lower abdominal pain. The most common feature on examination is the strawberry cervix. As you see in the first picture, there are petechial hemorrhages on the cervix. It's a typical feature of this trichomoniasis. And incubation period is usually 4 to 10 days for trichomoniasis. So diagnosis is usually done on the basis of clinical findings as well as the saline wet mount preparation in which we identify the parasite. Treatment is usually 2 grams single dose of metronidazole orally, and for trichomoniasis, reinfection occurs in about 1 in 5 people within 3 months after receiving treatment. So to avoid reinfection, it's very important that the sexual partners should also receive the treatment at the same time. Behavior, use of condoms, and treatment of partners. Thank you. So, anyone has any question?
Hello, madam. Thank you so much from your precious time which you have given us and for providing such informative lecture. My question was in gonorrhea test, you have mentioned one test by the name of complement fixation test. What was that test?
Complement fixation is a blood test, usually is seen to check the antibodies.
Okay, thank you so much, madam.